We've talked about a concept of the lungs where the oxygen gets into your lungs, but we didn't really talk about the carbon dioxide part of it. As you know, the lungs, the job is to get oxygen in and move carbon dioxide out. And the amount of carbon dioxide generated depends on your metabolic rate. And in patients with, for example, COPD, where they have chronic obstructive lung disease, you're going to have a situation where the lungs are not able to exchange the oxygen and carbon dioxide effectively because there is not enough surface area. You may remember that the lung normal surface area is the size of a tennis court, 75 square meters. And when you have that setting, you're going to end up with a surface area that is less because of, say, somebody had one lung taken out, or suppose they have COPD and there's not enough surface area for the gas exchange to happen. That's something to look into. Now, the concept to remember is the tidal volume. So we have talked so far about the principle of oxygen coming into your body through the air. We talked about how it attaches to the blood cells, how it goes across the alveolar capillary basement membrane, how you can measure the saturation or the PO2, the interaction between the oxygen molecules. And if you remember something called the oxygen hemoglobin dissociation curve, you will see that curve, actually I'll show that to you in a couple slides. It's a sigmoid shaped or S-shaped curve, and the reason it's S-shaped is because of this principle where the oxygen affinity keeps increasing as one oxygen attaches. Now let's talk about what is tidal volume. So let's take an average male, say 5 feet high, weighing about 60 kilos. Now remember, the size of the lungs is not dependent on your weight. It depends on your height and your gender. Now, a fat person may actually have smaller lungs despite having a very high weight. And the reason for that is that the height determines lung size. In addition, if you're obese, your diaphragms may be pushed up, and that might lead to even smaller lung size. So the tidal volume is the amount of air that is mixed with additional oxygen sent by the ventilator into the lungs with each breath. So as you're breathing, the oxygen keeps going in and out. And what you'll look at is once the oxygen goes inside your lungs and the air goes inside your lungs are going to expand. And the tidal volume is something which is available to like your patient, and it goes to both lungs, and the number is set by you on the machine. Let's take an average 5-foot male. The calculations people have made is that a 5-foot male, you have to take 50 kilos. A 5-foot female, the average ideal body weight is 45.5 kilos. For every inch that they are taller than 5 feet, you add 2.3 kilos. So for example, you have a 5'8" male, it is 50 kilos for 5 feet, and then 8 times 2.3, you end up with 68.4 kilos is the ideal body weight. Remember this formula because this is critical to managing somebody with ARDS. Now, I'm seeing some questions popping up in between here. For example, people are asking for the presentations. I think these will be shared with you towards the end. And what I would suggest you do is try to understand these concepts and follow along as we are talking, because there's no other way to learn except to really get the concepts inside, because then you can ultimately, without any presentations, rebuild this every time you face a situation. Understanding the basics is critical to managing even the most complex situation. And most of the time, if you go to the basics, taking a history, examining, looking at the vital signs, and getting some basic lab work, you can troubleshoot and solve a lot of these problems. So if you look at this graphic here, you can see at the far extreme, an obese 80 kilo, 5'8" male, his lungs are the same size as a 5'8" male weighing 60 kilos because their gender is the same as well as their height is the same. However, a shorter person who is 5 foot and weighing 60 kilos will have smaller lungs. A 6'2" male who's 80 kilos will have bigger lungs, but a 6'2" female weighing 80 kilos will have little smaller lungs because of the gender differences. So the concept here is that the tidal volume is the air going in and out, and it's important for us to realize that the air that is going in and out is set by you and also depends on the ideal body weight. This is an important concept we're talking about next. So we talked about this balloon that we're blowing. So when you blow this balloon open, the air tries to stay inside. So when it's actually, I'm trying to see, we have just a few more slides before we get to the video, and then you'll be able to kind of understand all of this in even more detail. So there's something called the plateau pressure. So once your air goes into the lungs, it goes right inside, it's expanded the lungs, and what you need to find out is what is the pressure inside the lung, and what is the pressure that the lung is facing when the air goes inside. And that pressure is called plateau pressure. It's called plateau because, as you can see in the graph, the air goes in and out, and you can see the air going in on top and coming down, it's exhalation. And on one axis, the x-axis, you have the time and the flow on the upper one. So it's a very simple graph. Essentially, it's telling you that as the air goes inside with time, the flow rate increases, then the flow rate comes down, and then again it increases back up. And when you're doing this, you can do something called an inspiratory hold. Most ventilators will have a little button you can press, and you will press it usually for a half a second or so, and that will stop all airflow. When all the airflow stops, the ventilator has a little sensor in the tubes which will actually pick the pressure up and say, okay, this is the pressure. And that number for you to remember is 30. It should be less than 30. The reason is that many studies have shown that if the pressure exceeds 30, you end up with a significant amount of lung damage, and it's important that we recognize that. This concept will be coming back to again and again. It is the pressure at the level of the alveoli and the small airway, and it's measured at the end of end inspiration. You take a deep breath and hold, and that is the pressure your lung is facing.